Around mid-December 2019, there were reports of the novel coronavirus in China's eastern city of Wuhan, where it was crippling several people. The virus is now reported to have killed 17 people in China and over 500 people are reportedly infected. The virus has also reportedly spread to Thailand, Taiwan, Japan, Macau, Hong Kong and the United States. Today, the Health Minister Dr. Jenrutha Cheng has assured Ugandans that the virus is not yet in the country, but officials remain on high alert to ensure no infected persons arrive undetected into the country.
Because the coronavirus causes respiratory infections, following a flu-like illness, it appears like a pneumonia. So what we are doing is, for any cases that are presenting with signs and symptoms beyond what we normally get in our country, samples are being taken for analysis.
Dr. Cheng says the alert response team is already screening people coming into the country. This comes at a time when several Ugandans travel to China for trade.
But the screening goes an extra mile. Apart from screening for fever, we also screen physically for those who have a flu-like illness and fever and are coughing.
According to the US-based Center for Disease Control, a person is deemed at risk if they have runny nose, headache, cough, sore throat, fever, a general feeling of being unwell.
Now there is a very thin line between the presentations and Ebola as well. And so the health workers are being trained on the signs and symptoms and what to do while we are screening for this.
The cautious message came during a ceremony to honor former State Minister of Health and General Duties, Sarah Opendi, who formally handed over to her successor, Robin Anabanja. Opendi, who served the health ministry for 8 years, decried of corruption, drug theft by some health workers as a major stumbling block for service delivery.
Corruption remains a key thorn in health service delivery in this country. There are issues of absenteeism, theft of drugs. We have talked about corruption, absenteeism of our staff, drug safety, and of course bribery in hospitals as key challenges that you have left behind. Together, me and you and all of my other sister colleagues, we shall handle.
Opendi now takes over as the State Minister of Energy and Mineral Development. Juma Kiria, NTV.